communities. So thank you again for joining us. So aloha everyone, and welcome to the Hanahau'oli School Professional Development Center. We're so glad that you're here and that we're going to be learning together as a community and thinking deeply about the ways that we can improve life in our community in face of the COVID-19 pandemic and the work that we do in schools with children. I'm Amber Strong Makayao. I'm a professor at the College of Education at the University of Hawaii at Manoa, and I have the privilege of being the director of Hanahau'oli School's Professional Development Center, serving as a bridge between Hanahau'oli and the College of Ed and providing programs for the community at large. Today's program is titled Safer School Reopening, COVID-19 Strategies for Educators, and it's brought to you by the Pacific Alliance Against COVID-19. This is our town hall. It will be held today and tomorrow, and you're welcome to join one or both sessions from 3 o'clock to 4:30 Hawaii time. I just wanted to give some framework to the work that we do at Hanahau'oli, which I think resonates with the work that we're going to do today. Our work is framed around this quote by John Dewey, the progressive philosopher, who wrote, "As a society becomes more enlightened, it realizes that it is responsible not to transmit and conserve the whole of its existing achievements, but only such as make for a better future society. The school is its chief agency for the accomplishment of this end." And our work at the Hanahau'oli Professional Development Center is around specializing in progressive philosophy and education and all of those things that fall underneath that umbrella of education. And we offer public programming such as coursework, a summer institute in thematic curriculum design, workshops, hosted conversations and public talks like this one, school visits and tours, mentoring and teacher education, educator and researcher exchanges, and online progressive education resources. And if you're interested in staying in touch with us beyond this program, please follow us on Twitter or follow our blog that you can subscribe to along with our programming information as well. So before we kick it off, we just wanted to make sure that our work today is done under this idea of intellectual safety in this space together. In an intellectually safe place, there are no put downs and no comments intended to belittle, undermine, negate, devalue, or ridicule. Within this place, the group accepts virtually any question or comment, so long as it is respectful of other members of our circle. So we kindly ask that you maintain intellectual safety with one another today. Please keep your mute on throughout the town hall forum. If you can, leave your camera on so that the panelists and the participants can connect with you visually. Consider using the presenter view during screen sharing and the gallery view when we're talking as a large group. And please, we ask, we have a large amount of people attending today because this is such an important topic, that you generate your questions and make comments in the chat. And based on our large group size, the event organizers will moderate your questions and comments and read them out loud to the panelists, time permitting. So with that, I would like to pass it off to Kumu Hewitt to get us started.
Aloha mai kako, o tutuman kawai kapu o kalani Hewitt ke ia. I am very honored to be here to start this meeting with an oli that speaks about the creation of life and also the perpetuation of life. It is called Ola Ikaha, life that came from the first breath. Ola ikaha, ola ikawai, ola ikai, Hawaii, 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 Wakea kalani, papa ka honua, no ka luna ko luna, no ka lalo ko lalo, Ho'ohoku, kalani ka wahine, haloa ke kalo, haloa ke kanaka, haloa ka koe. O ka pono no ia e, o ka pono o Hawaii ne. Ke aloha nui, ke aloha nui, ke aloha nui a kako. Mahalo. Thank you.
Mahalo Kumiku for getting us off on a good start and welcoming us and having us bring our best pieces of our souls together into this shared space. I'd like to thank the people who are going to be on our panel today. Very briefly, we are very privileged to have Dr. Sarah Kemble and Kara Gormont, who are with the Department of Health. They will be followed by Alika Mauna Kea, who is one of the PAAC team co-PIs, and then it'll be followed by Paul Kepka, who is a principal at Kamaile Academy, and then Gail Vannatta, who is the assistant principal at Damien School. And if Sarah, I have to check, Dr. Kemble and Kara are here?
Yes.
Also, okay, great.
Yes.
I will start a brief introduction about you. Okay, we're really privileged to have Dr. Kemble here. She is the state epidemiologist for the Hawaii Department of Health and chief of the Division of Disease Outbreak Control. Dr. Kemble received her MD at UCSF, completed a residency at Internal Medicine and Pediatrics at UCLA, and an infectious disease fellowship at Rush University Medical Center in Chicago. While a fellow in the Epidemic Intelligence Service Program at the Centers for Disease Control and Prevention, she served as a field officer at the Minnesota Department of Public Health before returning in March 2019 to Hawaii, her home state. Welcome back, and joining the Hawaii State Department of Health. Dr. Kemble will be speaking with Kara Gormont. She is the school testing program director. She served in the U.S. Air Force, where her last leadership position was chief of staff for the military health system in Falls Church, Virginia. Kara is a registered nurse in Hawaii and holds board certifications with the American Nurses Association and the American College of Hospital Executives. She collaborates with healthcare and community experts to solve complex population health problems, and this challenging position is what motivates her. Thank you very much, and please welcome to the town hall.
Thank you so much for those kind introductions. I think Kara is driving the slides.
Yes, I will put it up right now. Thank you. Okay.
So what we wanted to do today is we really have a pretty brief presentation because I know there are so many questions out there. We wanted to leave extra time for Q&A on these topics, and we can also try to address any additional questions in the panel at the end of this session. So today's talk is titled COVID-19 School Update. Let's go to slide 2.
I'm sorry, going back and forth between them.
No problem.
Not very good at holding the slides. There you go.
There we go. So what I'm going to talk about is the updates to the school guidance and the evidence that's accumulated around schools is really tremendous over the past year. So we've learned a lot about how transmission does and doesn't happen in school settings and what things help to mitigate COVID-19 transmission. So that's what the latest guidance reflects. And this is based on updates from the CDC that came out in July, but with some additional considerations for our local situation. And the emphasis here really is on these core essential strategies for which there's such strong evidence that these measures are effective in preventing COVID-19 that they should always be implemented. And those are vaccinating all those who are eligible. So promoting vaccine, even for those younger grades where you have students who are ineligible, still promoting vaccine for all adults that surround those children, whether that be in the classroom or in their households, is really important as a measure to reduce the risk of introduction of COVID-19 to those susceptible students. Another is staying home when you're sick. And we hear this all the time, and this is a mantra within schools, but this is all the more important right now where those who are symptomatic, not everyone who has COVID-19 is symptomatic, but actually a substantial proportion are, and those who are asymptomatic are also likely to be more infectious because they may be actively coughing or sneezing, and thereby spreading more germs. That importance of staying home and sick, we cannot overemphasize. Universal masking in schools is another core essential strategy, and that means wearing your mask at all times when in indoor spaces. Many schools are also finding it easier to implement mask usage in some outdoor spaces as well when you have anticipated close contact among students and or staff or crowded conditions. So masking is simplest when done as a universal policy and is definitely one of the strongest mitigation measures we have to reduce transmission between those in the schools. And then finally, hand washing, which is a hygiene consideration that's not limited to COVID-19. This is something we've always emphasized, and COVID becomes another reason to emphasize the importance of hand washing, especially at key moments in the day, before and after eating, after going to the restroom, and before and after going on the playground. The other mitigation strategies are also presented in the guidance, and this goes through a laundry list of options, a menu of options that schools now have to further reduce transmission in their settings. And this can include things like establishing Ohana bubbles or cohorts, improving ventilation, implementing physical distancing, and then screening testing, which is now one of the things that Kara will be talking more about, what the options are for implementing screening testing in schools, and cleaning and disinfecting. The guidance also addresses extracurricular activities in a risk-based approach, looking at what the strategies are based on risk. This is with the understanding that extracurricular activities are inherently going to be riskier than some other school activities because they introduce a different level of mixing. We're going to have students who aren't otherwise going to be together during their typical in-classroom time together in the extracurricular activity in many scenarios. And the other reason that they may be inherently riskier is with activities such as sports, where you may have stronger, deeper inhalation, exhalation. You're doing activities that cause more air exchange and greater potential for aerosolization. The case investigation and contact tracing piece is looking at what are the protocols. There's now very well established protocols for what should happen after someone tests positive and for their close contacts, the people that they came into close contact with. So it's just making sure that this information is really widely available and understood by everyone. And this is not something that, to me, it's really important that this isn't something that is owned solely by the Department of Health. This information should be at everyone's fingertips. If you were to test positive tomorrow, what would you need to do? What would you need to tell your close contacts? And really the role of public health here is to get involved when there's more complex scenarios, like a cluster of cases and potential transmission, and to get involved in and do the investigation to understand why that transmission might have occurred, and to provide technical assistance and guidance to prevent clusters from happening. So I'm sure there will be a ton of questions on the guidance, but I wanted to give Kara the mic for a little while to talk through what the testing options are, because we get a lot of questions right now around screening testing.
Yeah, thank you, Dr. Kemble, for that. With that, the best option that we have right now is actually a totally free option for you all, that if you wanted to enroll in, you can send me a message and I'll put my email into the chat after this so that we can get you all enrolled. But the testing is provided to us by Health and Human Services. The grant has actually been given to a company called Perkins Elmer, who has subcontracted with a company called Colors Health. And they are already actively working with 129 schools across the Department of Education, as well as an additional 22 community sites to do testing here in Hawaii. So what is this? So Operation ET is eligible through K through 12, particularly for vulnerable populations, to make sure that we are doing the testing, to do surveillance, to find out who has COVID actively in your schools and in your communities. And then that will allow you to utilize some of the techniques that Dr. Kemble was talking about earlier, as far as contact tracing and isolation and protecting your schools. They are in partnership with a local laboratory to make sure that we get turnaround times within 24 hours. So what will happen is if you register your site, you are able to then get a dashboard, which you can see down on the bottom right-hand side, that you will have access to know exactly who within your site or even in your classroom would have, depending on where you register, you would have access to that information. So once you register, you would actually go out and advertise. You'll get a QR code that you could advertise directly to your population, whether it's within athletics or within a whole school. And you would be able to ask people to volunteer to be tested. They would have to consent for testing. And once they consent for testing, they would enroll. If they have a smartphone, they can download the information and enroll right on the smartphone, or there's a way for you all to help them enroll with a computer at the schools. Once that is done, Colors Health will create your account, and then you would go back in and order how many test kits that you would want. And then they will send those to you and ship you a box of all the kits. And then they would also include a box for returning and labeling for returning. So in order to collect the test specimens, you do not need to have any type of medical degree. It is a self-collection. The site actually is a little bit misleading because it looks like somebody is doing the test for this child. But really, we like to tell people that if a child can pick their nose, which we think most of them can, they're able to collect their own specimen, because as long as they have some supervision for somebody who's been trained. But basically, you take the Q-tip and you roll it around the front of your nostril, for about 3 seconds on one side and then 3 seconds on the other. Then you drop it back in the test tube, and the test tube is put into a biohazard bag. The biohazard bags are then put into the shipping specimen that's labeled for testing, and within 24 hours, you would receive your results. Not only would you receive your results as the person being tested, but also you would receive your results as the Department of Education or teaching institution that would be enrolled to do the testing. And automatically we would get the testing results at the Department of Health. So there would be a linkage there for us to evaluate and see where any trends are. With that, I do just want to say that there are 129 sites on, across Hawaii right now with 22 community sites. We're getting more people to sign up every day, and please, I'll put my email into the chat and contact me if you'd like more information, because this is free and available to you now. And another question that I get is, how long will it take if I sign up? It used to be about 5 days by the time you signed up to the time you would get your kits and you could start your testing. However, they're getting such a rush of people that are wanting to sign up right now that it could be 5 to 7 days. So within a week and a half, you should be able to do your first testing. I'm just going to go over these very quickly because these are some additional options that we have. But the CDC also funded a reopening schools grant to increase our ability for screening testing. And I just want to mention the National Kidney Foundation, who had collaborated particularly on the Big Island over the summer to do some pilot programs where they were offering testing in schools, and they also offered voucher programs for the local pharmacy for people to go out and do the testing at a local pharmacy. So with that, we are continuing to work on CDC funded reopening schools grants to continue to partner with companies that can, continue to offer additional services. One of the difference between OET versus the grant that we are working on right now is that OET, really requires some augmentation from the staff, already inherent in the organization to implement it. But with the grants that we are pursuing right now and trying to contract with some partners, we are asking for fuller staffing solutions. We are already entering into an agreement with National Kidney Foundation to go to all the neighbor islands to work with Department of Education, particularly, although their goal is to get through all schools, their starting point is K through 8, tier 1 through 3. And what that means is the areas in the schools that have the highest social vulnerable index, which we worked on with the Department of Education to determine those sites. They would start there and then roll through the rest of the schools. So you may be seeing that coming to you in some of the neighbor islands in the next few weeks. And then on Oahu, we are still working with a vending partner to contract that. I just want to quickly state that we are also in partnership with the Hawaii Keeping Nurses, and we're trying to expand some of their services, as well as working with the federally qualified health partner or health centers, our public health nurses. And we are robustly trying to recruit for the Department of Health COVID-19 schools team. So with that, I know we are on a little bit of a timeline. We might have gone over a little bit. We have about 4 or 5 minutes left for questions. And I see there's quite a few in the chat. So I can go through those and see what we have. So Dr. Kemble, here's one for you. It says, why aren't the siblings of close contacts being quarantined at the same time as their sibling who needs to get testing? Is that something that you can take?
Dr. Kemble, we need you to unmute yourself.
Sorry about that. So our guidance is, in fact, that if there is a child who's sent home sick or needs to be tested because of symptoms, all siblings who are school going in that household should also be staying home until the test is obtained. That is the guidance that we have issued. And that is challenging, but it is also necessary with the current case rates, because the probability of that child ending up positive is reasonably high. And if they are, then those siblings are close contacts who would need to be under quarantine. So this is the key reason why we are working on getting all of these different testing solutions out to make testing available and accessible. So when that child is sick, they can get that test and the siblings can get tested, and you have some answers about what needs to be done for that household.
Yeah.
The schools that are telling the siblings to come to school, that is not following the DOH guidance.
Yeah. And as far as testing, we are working on some additional testing that you all can give to the family so that they can take that home and do additional testing for all of their family and siblings. So here's another one. Why is Department of Health using the outdated CDC recommendation of 3 to 6 feet for 15 minutes over a 24-hour period when Delta is transmitted much more easily? CDC only recommends that there should be no problem about informing all students in classes when a person who tests positive being informed and quarantined until clear.
The current CDC guidance, and we can put the links into the website for CDC school guidance, and it's also in our school guidance, is that close contact is still defined in the school setting as, assuming that you have universal masking. So if everyone is following universal masking in that classroom, then you are looking at within 3 feet is a close contact for students, and for adults, it's still 6 feet. That distinction was drawn based on evidence that in classrooms where students were seated 3 feet apart, there was not greater transmission compared to classrooms where students were seated 6 feet apart. So that for adults who may project further, or there's not good data to show that adults would be at that lower risk, so they're put into a different category. So this is all based on the data that we have, and that's what the recommendations come from.
Okay, thank you. And Dr. Kemble, another one about why are principals not being supported for contact tracing and helping with that contact tracing of close contacts?
So there, right now, and first thing I want to acknowledge is right now is an extremely challenging time for educators, and we totally get that. There's a unprecedented number of cases in the state. And so when we have disease transmitting in the community, we're going to be experiencing cases in the schools. So we acknowledge that that's challenging and disruptive. However, in order to make the best decisions that we can, we really need to do this in partnership with the schools. The schools are often the first to hear about a case that occurs in the school environment. And therefore, the fastest way to get notification out is for the schools to do that initial notification. So what we are asking of schools is to, when they get notification of a case, to notify us, but also to identify what, where the close contacts would have been. Is this a classroom setting where you can identify people within 3 feet? Or is this a classroom setting where there's mixing and therefore you're going to exclude the whole classroom? And then send notifications to all of those people. And this is, the schools have those contacts in the list. So that's what's being asked, but we are providing materials. So in our guidance, we have the one-pagers that should go out to families, a template for the letter. So we've done what we can to provide that template so you really can just plug and play to simplify that as much as possible. But we're definitely interested in hearing what are the other challenges people are experiencing. Are there other resources and tools that we can provide that will help to make that that piece of it easier? But that notification piece is critical because where the DOH resources, where we really want to focus them, are when we do have situations of clusters, meaning multiple cases that occur within a similar setting, be it a classroom, a bus route, and there then becomes questions, okay, what could be leading to transmission in this setting? How can we stop that? How can we prevent that from happening again? And that takes sometimes more technical expertise, and that's really where we want to focus, being able to be available as a resource for those scenarios and respond to those situations.
Okay, thank you. And Amber, this question is for you. We're a little bit over time. We still have a lot of questions. Would you like us to go through questions for longer and you tell us when you can when we're done with that, or do you want us to give back your time? And also, Dr. Kemble has another meeting soon that she needs to go to, but I can continue to stay on to answer questions.
Pauline,
I can return during the Q&A time too.
Okay, I would suggest that we could go a little bit longer because we would have had time for questions and answers further down. So what we will do is like push everything down a little bit and have a little bit less time for that last question and answer session. So
okay, perfect.
Go on till 3:30.
Yes, okay,
3 minutes.
Yep. You tell us. Okay, so Dr. Kemble, this is similar to the other one. Is the CDC guidance a little bit outdated based on the Delta variant? And this one particularly, if you talk about ventilation and aerosolization.
So I'm sorry, can you repeat the question?
Yeah, they're looking at the guidance for the CDC. Is it outdated based on Delta? Because if the classroom is poorly ventilated and aerosolized, the virus can fly farther than 20 feet. So should the entire classroom be put in quarantine if that's the case?
So when we think about microbiology and the science of disease transmission for an infectious disease like this, there's the outlier situations are always going to exist. And then there is sort of we look for that median, or what is the most common scenario. There are going to be instances where there was aerosolized transmission at greater distances. That's, there's been a few studies that document that type of thing, say in a restaurant with the airflow carrying it across the restaurant. However, in the vast majority of cases, and we've seen this playing out over and over again, that 6-foot distance, or in the classroom setting, the 3-foot distance really is a good benchmark to see where is risk high and where is risk low. Now, we can't eliminate absolutely all risk, but remember that under current circumstances, you're probably at greater risk walking around outside the classroom in a crowd than you are being anywhere in that classroom. And so it's really about looking at the level of risk and deciding what necessitates quarantine. The reason for the layered mitigation guidance is to catch those outlier situations where you might have missed a case that did happen to occur outside of the norm, but you have other layers in place. And so that's why we do emphasize maximizing ventilation, open air ventilation. That's a way to further reduce risk. Emphasize using distance as best you can to increase the spacing between people, because that's going to reduce risk. So there's a lot of things that you can do to further layer your strategies to reduce risk. Another strategy that we tell schools, if they're concerned about the possibility, okay, we excluded those people who were within 3 feet, but what if that other student who was at 6 feet did get infected? Well, you can do testing as a precaution in the rest of the classroom who you didn't exclude, and that would at least give you a signal to find out if you did have any additional cases. The probability is very low, and you're having people still mask when they're in school. And of course, if they have symptoms, you're sending them all home. So if you do pick up an outlier, then you have an additional piece of feedback to help you control that situation. So really what it is running all those layers together so that all put together as a package, you really have you're really maximizing safety.
Thank you. So we are at time. There are a lot more questions. I would be happy to try to answer them if you all want to email me. I'm going to put my email in the box here. But Amber, if this is the time, then we probably need to close it at this point.
Yeah, and then if you or Dr. Kemble might be able to return a little bit later, that would be great too. But thank you for a very enlightening presentation, and really being able to think about your own situation and what individual teachers need to do, and those opportunities now to be tested, because I don't know if the teachers were aware of that. So this is really, really helpful.
Yeah, thank you. And we're glad that it was helpful. Dr. Kemble?
Thank you for having us. Yes, and please keep the questions coming. They help us to hone our guidance and make it useful to you.
Great. Thank you so very, very much. I'd like to introduce now Dr. Alika Mauna Kea. He is with our PAAC team. He is a proud born and raised in Waianae. He completed his bachelor's at Creighton University, PhD at University of UC San Francisco, completed a postdoc at NIH, then joined the JABSOM School of Medicine. He applies epigenetic information to understand gene-environment interactions that underlie diseases of health disparities. Dr. Mauna Kea co-leads the PAAC Alliance. This is stands for Pacific Alliance Against COVID-19, funded by an NIH, what is called RADxUP, Rapid Acceleration of Diagnostics of Underserved Populations initiative. And this combines cultural messaging and education with community capacity for rapid SARS-CoV-2 testing. So you're hearing about the testing a lot. You're also hearing about the underserved and underrepresented populations. He's a panelist on the COVID-19 Prevention Network for the National Institute of Allergy and Infectious Diseases, advising on COVID-19 vaccine development, especially as related to vulnerable communities. So thank you, Dr. Mauna Kea, for joining us.
Thank you, Pauline. Aloha mai kako. Let me just share my screen. Okay, let's see. And there we go. Can everyone see that? Is that all up and up?
Looks good.
Looks good.
Great, mahalo. Thanks again, Hanahau'oli, for hosting us once again. Thank you all for being here. So let me just introduce who we are a little bit first. We are a multidisciplinary scientists and scholars that have worked with our communities to address health disparities for many years before the pandemic. And in response, formed a hui we call Pacific Alliance Against COVID-19, or PAAC, to conduct research to increase community capacity for testing, provide education, and develop data-driven strategies to mitigate the adverse impacts of COVID-19. Now, while each of us are professors from different colleges within the University of Hawaii, we partner with our local health centers, including the Waianae Coast Comprehensive Health Center, private and charter schools, as well as public schools, the DOE and the DOH, and the National Institutes of Health. So my job today is to share an update of where we are with COVID-19 in our communities. So I'm sure you've all heard, and it's been in the chat and a buzz about the Delta variant and how it's now dominating the Hawaii COVID-19 cases in the US, throughout the US, and in Hawaii specifically. It's important to know how this variant is different from the original strain that we faced in the beginning of the pandemic. So all viruses mutate, as I'm sure you all know, including the SARS-CoV-2, which causes COVID-19. Here's a model of the spike protein of the virus in red, and specific mutations that's caused amino acid changes to the protein as indicated by these arrows. Now, although it's small, it's thought that some of these changes allow the variant to bind receptors on our cells, depicted in blue, with a higher affinity than the original strain, making it easier for the variant to infect our cells. So this makes the Delta variant more highly transmissible than the original strain. It allows a faster spread throughout the community. There's also newer models that are predicting that you have to have a higher degree of herd immunity that's needed in order to reduce or mitigate this continued spread of the Delta variant. And individuals infected with the Delta variant have a higher viral load. It's estimated to be 1,000 to 1,200 times higher viral load in infected individuals than compared to the original strain. We also, individuals with the Delta variant are infectious sooner. It's about 2 days earlier than the original strain. And current evidence suggests that it does not increase the risk of hospitalizations compared to the original strain. This is what is indicated here. Now, from the Department of Health data in Hawaii, which is accessible on their website, we see that right now we are facing a huge increase in the number of COVID-19 cases that's largely due to the Delta variant, and it's the highest we've ever seen since the beginning of the pandemic. We continue to see that some populations in our communities are overrepresented in infections, and this includes Native Hawaiians, Pacific Islanders, and Filipinos. Now, this has changed slightly over time. Last year, Native Hawaiians were actually underrepresented in a number of cases, and that's gone up since. We also see a decline in the number of new cases appearing in the Filipino population as well as within Pacific Islanders. Now, this means that with this new surge, Native Hawaiians are now experiencing the worst of it. In fact, the OHA, the Office of Hawaiian Affairs, released a report earlier this month that indicates that the increase in COVID-19 cases are largely attributed to the Native Hawaiian population. This surge also caused our hospitals to become more overburdened to the point that there are currently no open ICU beds. And the majority, 90% of COVID-19 patients are unvaccinated. There are also higher rates of infection currently among youth. This is again Department of Health data that you can easily see on their website, on their dashboard, where in this case, the age group 18 to 20 years old account for the highest number of cases. And that seems to be rising recently with the surge. Now, what's driving these disparities in Native Hawaiians and youth? Well, they just aren't getting vaccinated. Currently, younger folks, as depicted here, have the lowest uptake of COVID-19 vaccines than others. And while the vaccination rates of most ethnic groups in Hawaii are beyond that representative of the population, their population rates, it's among the Native Hawaiians that remain significantly underrepresented, and that's what this graph is depicting here. You can also see that this varies by region, such as the low vaccination rates, about 35% or less in Waianae, where I'm from, and where our team is partly based. All right, so why is this the case? In order to understand this more and understand what might be causing this or contributing to this vaccine hesitancy, as well as to better understand the situation on the ground from our community, we are currently gathering data from our outreach surveys. So far, we have over 1,000 respondents, many of whom are Native Hawaiians, Pacific Islanders, and Filipino. And Dr. Juarez tomorrow will talk a little bit more about this data, but the one thing I do want to share from this information is that when we ask individuals who are unvaccinated why they haven't yet received the vaccine or won't get the vaccine, most responded that they either don't trust the vaccine to be safe, they're concerned about side effects from the vaccine, and they don't know enough about how well the vaccines work. Well, these concerns can be addressed by education. For example, we put together some data from trusted sources and show prevalence of conditions that people with COVID-19 experience side by side with that of the vaccine. I won't have time to go through each of these line by line, but basically this clearly shows that the benefits of the vaccine far outweigh the adverse and serious consequences of COVID-19. And it's the vaccines that have scientifically been proven to protect against these conditions. So for example, based on the new data, the risk of dying from COVID-19 is 150 times higher than from the vaccine itself. To put things into perspective, among those that were hospitalized in Hawaii with COVID-19, 9 of the 10 individuals are unvaccinated. COVID-19 related deaths in Hawaii are currently the top 3 next to heart disease and cancer in leading causes of death in Hawaii. Another way to think about this is that in Hawaii, 35 deaths among every 100,000 people each year are caused by accidents, such as the ones that we get from normal daily activities, like we all risk from driving, for example. This data means that you are 5 times more likely to die of an accident than you are from a vaccine, and 50 times more likely to die of COVID-19 than an accident. And vaccines not only reduce your risk of dying from COVID-19, but it prevents the deaths of others around you significantly. And that's been demonstrated by many other groups around the country, as well as in Hawaii. Another issue respondents had was with the vaccine was that they didn't know how well the vaccines work. Well, that's an easy fix. There are lots of good, reliable sources of information explaining how it works, like the one shown here, and a substantial amount of rigorous scientific studies backing it. We highlight some of these in our curriculum that you'll hear more about later. But I think personally, the best explanation of this is what my 16-year-old daughter came up with. Vaccines train your body to fight against COVID-19. And she's right. Vaccinated individuals are less likely to contract COVID-19, are less likely to spread COVID-19 to others, are less symptomatic and have less symptoms, less likely to be hospitalized. And in fact, this vaccine does protect against the Delta variant. It's 66% effective. And this was just new data from the CDC. So personally, I'd rather live with that protection than without. Also knowing that I'm doing my part to protect not only the lives or livelihoods from oblivion, but our culture as well. And I'm encouraged by the presence each of you here today, because you represent the hope we carry into the next generation. Mahalo nui. Oh, Pauline?
Yeah, got it. Sorry. Yeah, mahalo nui. That was a really important presentation. You showed some incredible graphics. We already have a request. So would we be able to share, put some of these graphics that you showed, because they're not even in our most updated lesson, to include that, perhaps even on the website. So on the PAAC info website, they don't even need to download a lesson, because I think this is ways that people can really understand risk in a more nuanced way than we usually have.
Sure, we can share that on the website along with the curriculum, and as well as the resources, the citations, and the body of evidence that this is based off of. So mahalo. Okay, would you be willing to you have a few minutes for questions? Let me read you a question from the chat. Whoops, it just left. I got it. Chat moves pretty fast. What can you tell us about the effectiveness of cloth masks, surgical masks versus KN95 or N95 masks? Well, I think other people can answer this on the panel too, but it's clear that surgical masks and K95, KN and N95 masks are more superior than cloth mats in terms of preventing transmission and infection. Okay, I have another question. Thank you for sharing with us today. And then the question is, sorry, it just jumped. How is it? Would people be able to know if a particular case is due to Delta, or all they know is that it's positive? Do they get feedback on that? So again, this is something that maybe if the Department of Health is on, they can also address. But yes, we do know that in some cases we have information from individuals whether or not what kind of variant they're infected with, and this is done by sequencing. This is the best approach. So you can actually sequence the virus itself and learn what kind of variant it might be. The Department of Health is actually doing this randomly throughout as they get positive cases, so that they can understand what's really affecting the population. And that's exactly how they were able to show and demonstrate that the Delta variant is overtaking now the new cases compared to the original strain. There is another question. I don't know if you'd be able to answer this one, but are there adverse reactions to the vaccination? What are possible side effects, and what exactly are we putting into our bodies?
that, maybe beyond just the so-called active ingredients, what might be causing some of the reactions?
Well, that everything's listed by the manufacturers, and we do see there's a large body of evidence that's on our website. So I'm not going to have time to go through all the details here, but we have that information available as resources and the links provided on the site so you can learn for yourself. Basically, what I showed was a summary comprised of information from Johns Hopkins University as well as from the CDC, listing the types of vaccine side effects that people get. And the more common type of side effects, or the most common side effect of the vaccine, is fatigue. And if those vaccinated in this gathering today have been, can share their experience with that. I mean, I can for sure attest to that. But individuals that suffer from vaccine as a result of the side effect, actually, it's 2 times less likely of suffering from fatigue than from COVID-19 itself. The other common side effect of the vaccine is headaches people experience. But again, it's 2 times higher prevalent with COVID-19 disease. And there are a number of other effects, but I think more serious consequences with COVID-19 condition itself than the risk of the vaccine. And I think, again, there's a growing body of scientific evidence, not just from what we see in Hawaii locally, but from around the country, that is taking a robust metadata analysis, or looking at all these cases and examining it more carefully so that we know exactly what's really going on. And again, the data is telling us that bottom line, the vaccine is a lot less risky than suffering through the consequences of COVID-19, which include death and serious consequences that are long-term, potentially. Long-term effects, we've heard of the long haulers, for example, that the vaccine does not do. There's no evidence for the vaccine to cause that. The vaccine itself is, again, for the mRNA vaccines, I think I talked a little bit about that and showed that slide. If you look at our website, we have more information on the module 4, just describing what the composition of the vaccine, those mRNA vaccines, is and what it's doing in the cells. Again, it's a transient small RNA that when it's in your cells, it provides the protein, the spike protein in your body that then your immune system responds to and generates antibodies. It's a transient process. Once your body starts to accumulate the vaccines against it, this RNA is basically eliminated from your system. It's very highly unstable. And your body recognizes that it had actually been exposed to this antigen previously. So you'll mount an immune response if you get exposed to the COVID-19, the actual SARS-CoV-2 virus, no matter the strain.
Thank you very much. I think there will be other questions as we go along, and then we'll see after we have our next couple of presenters, we will have time for people to ask those questions. We'll go back up into the chat and then try to address as many as possible. Thank you so much. That was incredibly informative. Thank you, thank you. I'd like now to introduce Paul Kepka. He is the principal of Kamaile Academy, and he will share a little bit with us about his testing program. Paul Kepka has taught in Waianae for 20 years. So Paul, so glad you could join us. And let's see if you are unmuted.
I'm ready to go.
All right, thank you.
All right. Hey, mahalo everyone for being here. Some tough acts to follow. So I got a lot of pressure here, but yeah, Paul Kepka, I'm the principal here at Kamaile Academy. We're a pre-K-12 charter school on the Waianae coast. We serve about 1,000 students. We have a staff of about 150. And, last March, and we've been in collaboration with I think, PAAC since the beginning here, and the Waianae Coast Comprehensive Health Center. And I asked my staff if they wanted to participate in a pilot project back in, I think it was in February or March. And little did we know how important that project would become. And so we as a faculty committed to learning more about COVID testing, learning how we could serve and support our community. I'm going to drop in the chat just the PAAC website. I think everyone has access to that. But I'm just going to speak a little about what that program's looked like at Kamaile and kind of how it's grown. So I'm just going to share up the PAAC website so you guys can see it. And here's a picture of a of a kid taking a COVID test. This is an awesome Kamaile kid, happens to be my daughter, taking a COVID test here just yesterday at Waianae High School. So the program started with just our staff. And you'll see my nose here scratch across the screen. I'm the guy with the green shirt and the big nose. But it was the idea that we just started as learners, and we wanted to learn about growing a culture of COVID testing on our campus. And so it started really small, and I would empower, I know there's a lot of urgency, but sometimes when you got to eat a big piece of cake, just take one bite. And that's what we did here at Kamaile. And we started small. And I think the first week we had about, 20, 30 staff participate. And then we started growing, and our last week that we tested here, we had over 170 people testing. And so we've been testing every Monday since March. And basically just some things to think about as we're learning about testing in schools. I think one, we want to just try to, so if you click on the website, it'll tell you more. You can research this. There's my big nose there. About testing, but the idea of just trying to make it as easy as possible for people to test. And I think we learned a lot in the process, and we learned about how to make it easy for folks to register. And we started with teachers and moving to students and community. But I think part of the things that we tried to do was to make it really easy and really predictable. I think if we want people to do COVID testing in schools or in any settings, it has to be accessible and really simple. And we've got it now to where, you can register really quick. It's a few clicks. The first time we registered, it takes a little bit of time because you have to answer some questions, which I think Dr. Mauna Kea here, Alika had just talked about. But the idea of collecting data, which is really important. But for our parents, as we moved it out, once they register one time, it's really simple. I would also say that for us, it's been really powerful. And we started as a pilot, and then we've expanded, and now it's in many different schools along the Waianae community. And so one of the things that's been very helpful for our school community is that parents and students know now that they can test 4 days a week, within the 11 miles of the coast where people live. From Hanahau'oli to we're the farthest, Waianae would be the farthest school on the coast. And it's very, very easy for people to do. We get the results in 15 minutes. So I think that's really important, is that for my staff and for the parents, that they know right away, and they can go home to their families and know that they're safe that day, that they got a result that's whether they're positive or negative. We've only actually had one positive on campus as a result of that, which I think speaks to the strategies that we've been using at the school. But it's been very helpful, I think, for people to build confidence in the mitigation strategies within the school, and knowing that the work we're doing is good. So the test results are emailed or texted to people. It's all confidential. I, as a principal, am notified of a positive, as well as the Department of Health. That's important, so we could immediately begin, contact tracing. I will say the one positive we had, it was awesome because we found out right away, and we were able to get right to it and keep people safe here at the school. I think one of the things I just like to sort of end with is that, as an optimist, I think principals are generally positive people. And we've been utilizing, as we have to call families and inform them that their child's been in close contact, as an opportunity to say, hey, let's take advantage of this COVID testing, and don't just test your child, let's test the whole family. Let's all get tested. And we've been using it as an opportunity to educate our families, to support them. I mean, it's scary when you get a call from a principal that your child's been in close contact. And I think that being able to, provide them with easy, predictable, consistent testing in our community, which is at risk right now, has been really beneficial. So that's just a little bit. I'm much better at fielding questions than speaking, so I'd be happy to field some questions for you. I see one here is like, who's been paying for this, and again, it's been in partnership with PAAC. So PAAC is paying for this program, and I didn't fail to mention it, but I think our pilot project led to a significant grant for PAAC to support and grow this program. And I think on that note, I'd say that, as we address COVID in our communities, it's a kako thing, right? It's all of us working together. And I'm so proud that our schools are working together, whether we're a DOE school or a public charter school, but it's about supporting the community together. And I think this project is very much representative of that. So I'm going to stop talking now and hand it to Pauline. And if you like, I'll field any questions I can support the community with. I'd be happy to do that.
I'll read a couple of the questions. I think I'm unmuted. Yeah, thank you so much. That was really informative to build a culture of testing and awareness, and then that opportunity to make that call to parents so that the whole Ohana can be tested too. You do have a question. I think you had mentioned a little bit. What is the population of your school?
Yeah, so we have, it changes every day, right? But right now we have 982 children. 56% of our children are Native Hawaiian children. And it's a pre-K-12 school. Majority of our school is in our elementary. We have 700 children in elementary school here.
Right, and most of them are not able to be vaccinated. So there's always that opportunity for vaccinated and unvaccinated people to mix. You have another question. I don't know if you could answer this, but maybe somebody else could. What kind of tests might you be using? And I don't know if anybody can answer that one.
I think, yeah, I know that they're very easy, and they're the swab or the antigen. I think when Dr. Okiero first started telling me about this, I didn't even know how to spell antigen, but now I do. But I don't know the brand of the test. I know this came up in a town hall the other day. Dr. Mauna Kea, do you know the name?
Yeah, it's the Abbott Binax Now kits. These are rapid antigen test kits, which are pretty accurate, but we follow that up with PCR testing as a confirmation for the positive cases. And so we're really, also with the PAAC grant we were able to get, we're expanding two different things. One is the community capacity for testing. So at the comp, we just installed the first ever molecular testing facility at a federally qualified health center in the state. And that's the PCR technology. So the antigen positive cases that come back from the rapid detection and the rapid screening tests are then sent to the comp for a rapid turnover within 24-hour turnover of the PCR result for that confirmation. So it's highly accurate. The other thing is we are going towards expanding the program to other sites throughout the state, working through our federally qualified health centers, not only in Waianae, but in Waimanalo, the Big Island, as well as in Molokai and Maui.
So people are very happy that this the testing kind of is being made more available. So I hope that in the chat, or as we kind of wind up to go back to, maybe I should do it right now. Perhaps Kara, I think you're still here to talk a little bit about how schools can apply for the testing.
Yes, hi. Yes, I'm still here.
Thank you.
So hold on a second while I turn on my video. I did put in the chat my email as well as some of my colleagues' email, just to make sure that we're covering down and we can get back to you all as quickly as possible. So essentially, once we get an email from you, we will send you all of the information that you need to learn a little bit more about the program as well as to register. Once you register for the program, it will take a few days before you hear back from Colors Health. And then they will send you an email with a unique QR code for your school and to help you register for what's called an alum account, where you would go in and order your testing supplies. And then after that, within a few days, you should get your testing supplies and then be able to walk through your first testing operation. And again, we're here to support you all and setting that up. But it will take a little bit of time and effort on the front end for somebody to read the email and understand the PowerPoints and really kind of dig in for a few hours to understand that. But the training is very simple. It is a video that's about 30 to 40 minutes long. And there's lots of really good, very graphic handouts that really walk somebody through. I think one of the positive things is if you have staff that are impacted by the governor's requirement for unvaccinated staff to have once a week testing, or if you have athletes or extracurriculars that are required to have twice a week testing, that is a really good option because it gives your schools the opportunity to, or even it doesn't have to be a school, it can be communities. And somebody put in the chat whether a preschool could be there in that as well. So we're pretty much opening it up at this point. Just register, let us get you this information so that you can start testing in your schools, but it gives you that opportunity to have that control of when and how often and who needs that testing. Does that answer the question?
I think so. That's very, very helpful because this is something new, and I think it's a tremendous opportunity. People feel a little bit more control over their health and safety of themselves as educators and for their students and their families. Thank you so much. I'd like now to introduce Gail Vannatta. She is the assistant principal. She's a former health teacher, and what she will be talking about is a very comprehensive program to get ahead of the virus, so to speak, well before school opened, and then continuing. And you'll see from her presentation that it's a very comprehensive program. Thank you very much, Gail, for joining us.
Well, thank you very much to everyone who's involved with the Pacific Alliance Against COVID. I feel very humble by the opportunity to share what Damien Memorial is involvement with the PAAC is. First off, I want to say really what everything comes down to as what we're doing today, it has to do with Pilina. It has to do with relationships, and really our involvement with the PAAC was with because of a relationship that we had with someone who referred us to Dr. Chin, and just wonderful things came from it. So I want to share with you a little bit about what we're trying to do. And again, it's our humble beginnings of this. So I don't know why it's not reading my desktop.
You should have share privileges. Let me see.
Let me see. I get this error message when I'm trying to share my desktop. Let me see. Open system preferences. Full disk access. Oh my gosh. I do not know why it's not.
While you discuss and you try to do that, I'll go into, because you sent me the
yes. Oh,
yeah,
mahalo.
so I'll try to do that. Okay,
so
I'm a little slow, so keep talking.
Oh no, thank you,
Yeah,
you,
go
mahalo.
ahead.
And so what I want to say is Damien Memorial is a school, in case you do not know, that's located in the urban core of Honolulu in the Kalihi community. And as you may know, that's one of the communities in which the COVID rates are higher than in other areas. Damien Memorial services approximately 603 students in grades 6 through 12, and we are a commuter school. So our students come to us from the Leeward coastal area, and when we look at our overall student population, approximately 21% of our students identify as Pacific Islander, and 39% identify as Asian, which includes Filipino in that population. So at Damien Memorial, we know that we were in a situation where our proximity within the community, as well as the population that comes to us, many from multi-generational homes, put us at risk. And so what we had done during this past summer was held 3 vaccination clinics on our campus, and that was open to the public. And then we have our own protocols that we've been following. Much of what we're drawing upon has been discussed earlier. Oh, yay, thank you.
Okay, so tell me when, and I will just shift,
okay.
advance the slides for you.
Yes, please, if you could advance.
Okay.
And
Here we go.
okay, mahalo. Yes, and so you can kind of see where we're located if you don't know. And I just had taken a number on there, the active cases that was from the Department of Health. But mahalo, if you could go to the next slide, please. Thank you. So we did have 3 vaccination clinics that were open to the public during the summer, because we, as a school, part of our philosophy is that we want to be good members in the community, and part of our essential elements that we promote as a Catholic school is that we're here to help the disadvantaged and the marginalized. And we know we're in a socioeconomic challenge area. So, oh, next slide, please.
Okay.
So again, our essential elements as a Catholic school is that, you know, we want to stand in solidarity with the marginalized, and within our own organization promote policies that reflect a climate of compassion for what's going on, and as far as advocacy and access to information and good health practices is something important for us. Next slide, please. So we were so fortunate through, again, Pilina relationships that we were introduced to Dr. Chen and her team. And I'm so grateful that Dr. Chen and her team actually came to our campus at the end of July before school started to train us on how to use the modules. So these teachers actually volunteered. There were a group of 12, including our health aide who had come on board to learn how to use the 4 educational models that have been put together, and how that we can infuse that into our curriculum through interdisciplinary types of units, and or just taking out chunks of it and maybe using it through our advisory program. Thank you. Next slide. So if you're not familiar with it, on the PAAC website are the 4 educational modules, and Dr. Chen and her team came through and showed us the modules and how to go ahead and incorporate those into our classes. Next slide, please. So I have some information about, since school has started for us on August the 2nd, how the progress with what those teachers learn has been going along, and what our plans are to incorporate more of the module information as we go throughout our school year. So one of the participants was an English teacher who also has a philosophy class. And so what he's been doing is taking components of what he learned and having the kids talk about ethical issues involved with the vaccination. We heard sharing earlier reasons why people are not getting vaccinated, because maybe it's a fear of something or misinformation. So using different philosophical concepts and the information the kids are trying to process through to help them get a better understanding of what their responsibility is, or to emphasize with the viewpoint of another. Next slide, please. We also have I didn't update my slides, I'm sorry, Dr. Chen. We also have a 12 history teacher who teaches a current issues class. And within his current issues class, next quarter, second quarter, he is intending to incorporate the lessons from the generational health chart, which is one of those components of the 4 modules, as well as the Swiss cheese module that he learned from the teaching modules into his current issues class. And what he's going to title the unit will be COVID Impacts Upon Society. So as you can see, the modules can go from an English class, it can go to a history class. It doesn't have to be in like a health or a science class. And so what you see here is my attempt being the substitute teacher in a science class for a few weeks. Our science teacher could not come on board for 3 weeks. So I was in there, and on day 2, I noticed there's no lesson for me in our lesson management system for this class. Oh my gosh, what am I going to do? Oh, it's the PAAC modules in a science class. So next slide, please. So we had the opportunity to show the Kamaile Academy video of what you folks are doing with the testing, and the kids watched it and they liked it because it's people that look like them. It's landscape that looks like where they come from. So, you know, there was an immediate connection to that, and they were very intrigued with what was going on. And then the question that the students had to respond to was, how has COVID impacted your family? And what are your concerns about COVID? And so what we wanted to do, I wanted to do with this class as a substitute, was get a baseline of where their understanding is about COVID and the issues related to it. So next slide, please. And this is grade 9, and you can see what this child prior knowledge is of the COVID, talking about outbreaks in different states. And then the concerns that we're seeing as a reality. Another concern is that people are not getting vaccinated out of fear. So I can tell that this child has prior knowledge, discussions are going on from home. And then from there, I would try to see how we would springboard certain lessons that would come from this. Next slide, please. So this child was talking about long-term effects that were brought up, the long haul effects, brain fog, things of this sort. So I was really shocked, just sophisticated things coming out from this 9th grade class. Next slide, please. Other things that come out, and again, it's the Pilina connection, and maybe we can build on this as we continue to find ways to address why people are not getting vaccinated, but the concern for Ohana. So this child is concerned about their grandparents, and then that they got vaccinated, great, and when will we be able to take the mask off? And that was a continuing theme for our children. Next slide, please. And again, I share these things with you because this is top of mind for these young people. And really the teaching modules are so valuable because when you think about what we want to do as educators is to bring relevant, authentic learning experiences into the classroom, and how much more relevant and authentic could a pandemic that has affected everyone be? And so this child was so sophisticated in her wonderings. And if you can read what the slide is saying, is the child is projecting ahead, probably still wearing a mask and fear of getting the virus when it would have passed. So the child is projecting ahead. And when you think about how our psyche has been affected too, the social emotional components are another thing we're going to need to look at for our children. And these modules can really help us to address those social emotional, like the fears and the anxiety with facts. And so I would highly, highly recommend the modules, as well as this child is wondering how would the socialization aspects of kids who've been in lockdown, only learning online, learn the culture of school again. So I thought this was like, wow, such great things coming from just a question. What are your concerns? Next slide, please. So our next steps as a school, we've had only 3 advisory sessions. We do have an advisory program at Damien Memorial in which all students participate. So the 12 teachers who participated in the training session also noted a good way to get things out would be through advisory because everybody gets it. So we're going to be looking at that, and based on some of this great information I got from grade 9 kids, I'm thinking that we might focus our efforts in advisory on modules 3, which is protection and prevention, as well as module 4, as we're talking. I see all the questions in the chat people have had about the variants. So module 4, testing vaccines and variants. And so maybe that might help with some of the concerns of why people are not getting vaccinated and so on and so forth. Next slide, please. The other things we're looking at is just by luck, we had a 10th grade health teacher, a 10th grade English teacher, our theology in 10th grade who focuses on St. Damien of Molokai and his work with the Hansen's disease patients. And when we look at module 1 and we look at how our ali'i had handled these infectious diseases in the past, we can see that they did have social distancing, albeit very, very extreme, being isolated on Molokai, but very much like how we're talking about social distancing now. So our theology goes into St. Damien, and then Hawaiian history, the focus is on how infectious diseases had decimated the Hawaiian population. So the task now for grade 10, because all of the kids are going to have these classes, is somewhere by the end of the school year, they would have an interdisciplinary unit drawing from these COVID modules that have been provided for us. And then lastly, our next slide that we have.
Okay.
Oh.
I'm sorry. You know what? I was doing something else. So let me
Okay.
get this off.
Okay.
Oh, it's not advancing.
Oh, okay. That's all right. I'll tell you. So our next steps will be hopefully we're gonna see a call to action based on some of the wonderings, especially that young lady had about how can the socialization aspect of the younger ones who have been learning at home be addressed. And part of what our essential elements at Damien Memorial is to promote advocacy. So we do have a health club. I'd like to challenge them to see if perhaps they could address that by coming up with a digital format that maybe we could go over, you know, this is the culture of school and some fears and things that we can address and share that with maybe a preschool in our nearby community area. But I would highly, highly recommend the 4 teaching modules, their certification, if you go through it as a teacher, for you to become a COVID educator. But really, when we think about what is the mission of education, I don't care what school setting you're in, primary or post-secondary, it is to go ahead and bring authentic experiences into the classroom and help enable our young people to have the tools to face the challenges that they'll have in their future. And right now, this is the biggest challenge in front of us. So any way that we can help to address through correct information, infusing it into our educational packages that we have, I think is what we're all here for. And again, I would highly recommend the learning modules, going through it and bringing it to your school. But I really, really want to mahalo Dr. Chen, Allison, Kaleolani, and Alika for their work with this, and everybody on the team. And thank you for sharing it, because it's free, you know. So mahalo, that's what our journey is. And thank you so much.
Mahalo, Gail. Mahalo. You did have a kind of a question that's wondering, you have done so many of these things. How do you feel, and how does your staff and students feel? Does it feel that it is as safe as possible and that they kind of know what to do? And could you just sort of speak to that question?
Thank you. So we were 100% online at the beginning of the pandemic. And we were one of the schools that was the last to come back in on a hybrid model last school year. And we did that very purposefully to make sure that people understood what safety protocols we had in place as far as the staff, and then our families felt comfortable. And I know it's a hard position, like for Paul to say, hey, we're going back to distance, you know, but the bottom line is each school has to look at the needs of the community it serves, of the population. And so when we came back on for this school year, we said Q1 only. If your child wants to be out, they can be out 100% online, but by Q2, our expectation is that everybody comes back. And we do have our distancing protocols in place, and safety following much of the guidelines that were shared earlier. But I think it's because we eased in so slowly, and we're really trying to call people on it. And I also give credit to our teachers, and, you know, everybody's talking about HIPAA, you know, like disclosing all this medical stuff. But once the vaccinations first came out, people were self-disclosing, like, hey, can you cover my class because I'm going to get my first or my second shot. I'm out because I'm feeling these side effects. So we knew that pretty much almost 100% of our staff had gone out to go ahead and get the vaccination. So I think that's one thing that makes each other feel good. And then just what we've already set up in place as far as the cohorting of kids. We have shields around the desks. Lunchtime, we have shields around everything, cleaning, this and that. And so I think that went a long way to ease in. And then just the education part too, about what we're going to do in case something makes people feel better.
And I was wondering, when I went onto campus, one of your faculty members was taking temperatures and greeting everybody. Of course, everybody was wearing a mask. So yeah. there are these ongoing daily checks.
Yes.
And
we have a pre-check that you must do online before you come in. And you know, the questions, do you have a temperature? Have you been exposed to? On and on. And then the temperature check we have. But, you know, we try to, as much as we can with the airflow, you know, things of that sort. But we've been very, very fortunate. I thank Jesus for that. As far as having an active case, we haven't had. We did have somebody who was positive, but they were online. So I'm so thankful for that.
Thank you very much, Gail. It really shows that when your administrators, because I met, who was that gentleman who we met who had authorized the vaccination clinics?
Oh, that's our assistant head of school, Brother Christopher Hall.
And so he had welcomed in the vaccination clinic there. So the community and the faculty, I noticed that of all the people who were in the room with us, everybody had been vaccinated except for somebody who had a medical reason not to get vaccinated. So he was very, very, very careful. So I think there's a very high level of awareness. So I want to thank you again. And this is we have about 7 minutes. So we'll take a few more questions. And then what I'd like to do is have every panel member who is here, and if you don't mind, you could actually do it in the order in which you presented, do a 1 minute wrap up. So one or two last questions. Oh, we do have a question here that goes to everyone. About ceiling fans and ventilation, ways to move air around in school. So perhaps as an administrator, seeing all the classrooms, you might talk a little bit about that.
So part of what we do is we try to have the ventilation going as much as we can. We also had, when the pandemic first came about, was we installed instant I don't know what you call that, but so that there's hot water in all of the bathrooms, because our understanding is washing with soap and water with hot water will dispel the molecules much better. And I don't know, Dr. Alika, maybe you can speak to that, but that was our understanding, that hot water and soap was better than cold water. And so we installed hot water in every place we could.
Well, okay, so if somebody wants to respond to that, but then after this, there are some questions. And Alika, did you want to say anything to that?
No,
If
it just
not,
looks
yeah,
like there's
go
a lot of questions already coming out.
All
So,
right.
We can probably field that, right?
Yeah. Okay. There you go. It's a soap. That's the most important thing, folks. It's a soap.
Important.
Okay.
So,
Since we're at the last 5 minutes, let's move right into in order of the people who are here. If Dr. Kemble is here for 1 minute, and then Kara, and then going around in order of presentation, then Alika, you'll be next, and then Paul, and then Gail. This is your final 1 minute. So Kara, perhaps, I don't see if Dr. Kemble is here.
Yeah, I think she might have had to leave, so
Yeah.
I would be happy to go. Yeah, so with so many questions in the chat, they were really great, but we just didn't get to all of them. So I put my email in there. Please feel free to follow up with myself and my colleagues on the school testing team. We'll do the best we can to answer the questions. All of the questions and concerns are absolutely 100% valid. I just want to say to all of you all, educators and educators of educators, just how important it is, the work that you're doing, and how grateful that all of us are that you are out there in the communities and our front lines, really doing everything you can to keep our students and yourselves and the staff and the community safe. I mean, it's just, it's such important work. It's such a terrible virus. And anything that we can do that we can help you, we really want to be doing that. But again, just mahalo for every action. I know that your job is very, very hard right now. Thank you.
Thank you very much, Kara, and please relay our gratitude to Dr. Kemble for your precious time. Alika, would you like to take a 1 minute?
I just wanted to mahalo everyone here for the dedication and support. I know we're going through a really rough time in the pandemic. We probably didn't expect this new surge in cases, but just ho'omanawa nui. I think our ancestors provide us great guidance to do what we value most, which is protecting our community and our people from decay and destruction. So if there's any other information that you need or questions for our team at PAAC, that you can find us on the PAAC website, www.paac.info. I think I left that in the chat several times, and there's links to the modules that you can take a look at, as well as some videos that you can take a look at to understand what we're doing. And we can connect that way if there's any need for follow-up as well. So mahalo ya oko, please stay safe. E mana pono.
Mahalo, mahalo, mahalo. Paul will be next, but there was a question, because you were in the news the other night about moving to distance learning. So if you could just think about, and not just your school, but several others too, a little bit on why charter schools are able to do this, that kind of piece, and then what kind of also led to the decision to do that.
Sure. Yeah, thank you. So yeah, I don't particularly enjoy being in the news, but I always do it for the community and for our kids. But in this case, we're a charter school, right? We had the flexibility to make that decision. Schools are a reflection of our community. And, like I think with the COVID situation, just for Kamaile, we had 9 positive cases on campus that came into our campus in 72 hours. So there was a lot of activity on our campus. We had been putting together a contingency plan for this. Like, we were preparing for this because we know that the positivity rate in our Wai'anae community is very, very high. It's double that of the state, if not higher. And I felt that it was the right decision in collaboration with my administrative team, with the healthcare professionals, that I work with daily to do this for our children as a temporary thing. And right now our plan is to return on the 13th. It'll give us some opportunity to continue to refine our mitigation strategies and contact tracing protocol. But really it was about ensuring that our school community would be safe. And I guess like my message to everybody is that, you know, this is a community thing, right? The schools are one part of a community, but it takes all of us, you know, and testing is one mitigation strategy. Obviously vaccinations are the biggest strategy that we need to really, you know, get our community get behind. In our community, as Dr. Mauna Kea had referenced, it's very low vaccination. So we have very low vaccination and very high positivity. And so when you have that in our larger community, that impacts the operations and the teaching and learning that happens in our schools. And so, you know, these decisions aren't easy to make, but as a principal, I think the safety of our school community and the efficiency and the effectiveness of operations that impact teaching and learning are a priority here. So I'm optimistic that, you know, as FDA has approved Pfizer and we continue to educate and communicate with our community that the situation will improve. And I'm confident that our kids will be back in the classroom. So thank you everyone for allowing me to be here. I do encourage everyone to peruse the PAAC website. There's a lot of information on there about all the programs that were mentioned, and just mahalo to all their support. I don't think Kamaile or any of our schools could do it without that support. So thank you.
Mahalo, mahalo, mahalo. Before Gail, you give your final thoughts. Kara, you're being asked again. So everybody, Kara is going to put her email in again. Okay. So please look at that. It's going to be in the chat because we've had so many that I think you're having a little trouble finding Kara's email. So if you don't mind putting your email in once more. Gail, would you like to please give your final thoughts?
Well, mahalo to everyone with the PAAC and your hard work, your foresight. And I highly encourage anyone to, again, as Paul was saying, look at the modules. It's a wealth of information. And I just cannot get over it that it's free and you make yourself available. So mahalo for your hard work.
Mahalo, Gail, and thank you for your comprehensive view and the teamwork that I see at all levels of the school, including your students and their willingness to go out and actually be public health educators, you know, when it's safe and in however well they can be. So everybody, I want to thank you all for being here. It's 4:30. We will have another session tomorrow. It will be looking at Ruben Juarez will be presenting data, and you'll have a little bit more insight on how people think about vaccinations, looking at by age groups, etc. Be very insightful. Kaulino Kaimana will be presenting along with Kaleo Hanohano, who is a teacher at Kahuku, and she's been working for the past year piloting the modules and has some really, really interesting data that she would like to share with you. We also have Jamie Sack, who is a high school health teacher at Kaiser High School, and she also is an instructor with health education at the University of Hawaii. So you're going to have a very varied practitioner as well as a data sharing presentations tomorrow. And again, all of your comments and questions are welcomed. Please look, Kara has put in not only her email, but the emails of the people who work with her at Department of Health. And we're so grateful for this opportunity to have, you know, straight talk by people who are on the front lines in different agencies, different locations, all working together, because I think that's really the only way we're going to be able to go through this successfully. So mahalo, 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 and see you tomorrow. Thank you.
Thanks, Pauline. And I just wanted to add, we'll be sure to send out resources and recording links to everyone who is registered. So we'll see you all tomorrow and we will be in touch. Thank you, everyone.
Hello.
Mahalo. Aloha.